research in the area of health communication, and she has also been very active in researching language and mental health and business communication, among other things. Best known for her sociolinguistic work examining language use during genetic counseling encounters as part of prenatal and antenatal screening procedures, she has published numerous articles from this crucially important work, cementing a reputation as a powerhouse researcher and a formidable securer of research funding in the form of research grants, as well as sponsorship from industry sources. Her most recently completed GRF project is titled Communicating Genetic Risk and Uncertainty Across an Individual's Lifespan vis-a-vis Family, a discourse analytics study of genetic counseling in Hong Kong. She is currently working on a book with Zoe Fortune, CEO of City Mental Health Alliance, provisionally titled Happy Thriving Workplaces, that will look into workplace mental health, and this will appear with Routledge in due course. Her truly impressive networking ability, along with her tenacity and endless energy in bringing people together, have generated many opportunities for collaboration among those of us passionate about language and health communication. These qualities are fundamental to her work, and they culminated last year in the creation of the Research and Impact Initiative on Communication in Healthcare, known as REACH, a Faculty of Arts initiative pioneered by Dr. Zayts and now providing so many opportunities for many researchers, myself included. Today, she's going to speak to us about a slightly different topic from genetic counseling, but one that remains at the center of her expertise from multiple angles, and that is the impact of the pandemic on the mental health of working mothers. Please take it away, Olga.
Thank you so much, Brian, for this very generous introduction and all the nice words that you said. So I'd like to start by acknowledging my wonderful research team. So the paper that I'm presenting today is the result of collaborative effort and ongoing project on the impact of COVID-19 on women in employment, conducted in collaboration with the City Mental Health Alliance Hong Kong, a mental health organization founded by Hong Kong businesses, which currently has over 20 corporate members and a wide network of other businesses through its training programs. Two of the research team members, Zoe Fortune, who is the CEO of CMHA Hong Kong, and myself, I serve on the advisory group, are affiliated with CMHA Hong Kong. Other team members include Mariana Lazzaro-Salazar, who is at the Catholic University of Maule in Chile, Vincent, who is at Hong Kong U, and Sylvia Jaworska at Reading University in the UK. All research team members are also part of the Research and Impact Initiative for Communication in Healthcare that Brian has already mentioned. So, and I'm going to talk about the impact of the pandemic on working women. So since the beginning of COVID-19, much has already been published in both grey and academic literature about various impacts of the pandemic on women. The articles tend to focus on the negative impacts. For example, the economic impact is described in terms of the recession. So the current recession is compared to other regular, in inverted commas, recessions, and it is noted that previously men's employment was affected more severely than women's employment. However, in the current recession, the employment rate drop relates to social distancing measures that have had a large impact on sectors with high female employment shares. In addition, literature reports that the closures of schools and daycare centers have massively increased childcare needs, which has a particular large impact on working mothers. More women are said to be furloughed, laid off, had their paid work reduced, and lost their productivity. With regards to productivity of academics, which many of us will find interesting, an article was published in Nature in May 2020 about female academics who are reportedly posting fewer preprints and starting fewer research projects than their male colleagues since the beginning of the pandemic. That doesn't come as a surprise to many of us. So reports highlight that different demographic groups of women were affected by or are affected by the pandemic to a different extent. For example, mothers of young children, single parents, pregnant women, women on maternity leave, parents without family support, ethnic and minority groups have suffered the most. Across the demographic groups, it's been noted that women are disproportionately affected by a rise in mental health problems. So Burnout Britain, a report that was published in the UK in early October to commemorate World Mental Health Day, notes that as well as the impending recession and unemployment, we're heading into an unprecedented health crisis. There is, however, a silver lining to the pandemic, changes that can ultimately promote gender equity in the labor market, such as flexible work arrangements and increased involvement of father into childcare. So we hope. So when we talk about women in employment in Hong Kong, so how big is this group? So who are we actually talking about? In Hong Kong, since 1997, we've seen a steady increase from 36% to 50.8% of women joining the workforce, meaning that women comprise slightly more than half of the workforce. So those women who didn't join the workforce during these years related this to lack of childcare, rigid work arrangement, and discrimination on the basis of family status. So the government, to address these challenges, has been developing family-friendly employment policies. However, only 2.10% of employers, 10.2% of employers have been reported to have adopted these policies. The latest measures, as many of us would know, include 14 weeks maternity leave and 5-day paternity leave introduced in 2020. So prior to COVID, the government was also said to be promoting the practices of 5-day work week and flexi time, that is flexible working hours. However, there is clearly a gap between policies and how these policies are put into action. So it wasn't a good point prior to COVID, and obviously COVID has exacerbated the situation. And in our work, we have focused on the impact of COVID-19 on the mental health of mothers. So there is one more measure by the government that I would like to mention. So they've been working on developing various information resources. And the one that I'm presenting here is by Child Assessment Services by the Department of Health. So they've produced 2 booklets dedicated to COVID. One of them is titled Combating Against the Pandemic, Parent Resource Booklet. So the booklet comprises of 2 parts, supporting parents' physical and emotional needs and supporting children's physical and emotional needs. And I'll show you some examples from the first part, so parents' needs. So the booklet acknowledges possible physiological and psychological responses that parents may experience, and they include feeling worried, anxious, panicky, uneasy, nervous, helpless, angry, irritated. Parents may also experience difficulty falling asleep, insomnia, palpitations, sweating, loss of appetite, difficulty in concentration, and so on. So these feelings, according to the booklet, are natural and common, and they may vary across different individuals. The booklet then goes on to suggest various strategies to help parents cope with the current situation. And among these strategies are maintaining the advice to maintain regular daily routine and children's learning at home, and also to take a break when feeling overwhelmed by the surge of the information. Okay? So while these are undoubtedly very good strategies, they do appear like what I call a recipe style list of ingredients or list of strategies that can be implemented with the help of this DIY booklet. The very starting point of such self-help booklets is the premise that as long as you have the information about certain strategies on how you can improve your physical and emotional state, you should be able to do it. That's easy, right? You have the information. But as we all know, there is a huge gap between knowing the information and actually implementing that information and integrating that information into people's everyday parenting routines. There is a considerable body of research across different fields. I'm most familiar with research in healthcare settings that have shown that the practice of passively giving out information is outdated and ineffective. So in healthcare settings, studies have suggested using automated programs that would allow producing more individually tailored information. And also they've advocated using stronger guidance on the use of good design principles. In psychology, as my collaborators who are fortunate would probably be able to elaborate on, research has suggested involving co-beneficiaries into co-designing and co-creating various resources. The list that can be said about the resources that we've seen the government produce is that their value could be greatly enhanced if they are based on direct evidence and if they're also data-driven. And this is basically what we try to achieve in our project. So in our project, we've collected multiple sources of data on the impact of COVID-19 on working parents, and being mothers ourselves, and most members of my research team are mothers with children, we are particularly interested on the impact on working mothers. And some of these results we will be presenting today. So I will start with a large-scale survey that basically served as the starting point of our project. So the survey was conducted by City Mental Health Alliance in collaboration with Oliver Wyman and the team at Hong Kong U. Companies that are known to CMHA Hong Kong were invited to participate, and 2020 represents the third year of the survey, so we could also do a comparison across the years. The questionnaire was originally designed to address the gap in understanding the needs of the professional services working population in Hong Kong, to understand current efforts to meet employees' needs, and to provide recommendations for improvement. And in 2020, the survey was also adopted to reflect on the impact of COVID-19 on the mental health needs of those working in the professional services industries in Hong Kong. So the data were collected via online platform, and participants were invited to participate via their company in an anonymous format. So the survey wasn't very long, it took about 10 minutes to complete, and participants were also provided with information on mental health at the end if they in their responses highlighted the symptoms that may be causing them concerns. The survey received an overwhelming response. So in total, over 1,500 respondents, with 952 responses after the data were cleaned. So the data comes largely from Hong Kong, but for the first year, it also included respondents from other APEC countries. So Singapore, Tokyo, Shanghai, Beijing, Seoul, Sydney, Bangkok, Jakarta, and Mumbai. And this diversity of geographical contexts, as you will see, is reflected also in the responses. In total, participants were from across 12 industries, including technology, consulting, legal, financial, NGO, energy and utilities, industrials, entertainment, healthcare, real estate, transport, retail, and consumers. Analysis of the data is still in the early stages and should be interpreted with caution. So these are the results of the survey. So across the Asia-Pacific region, nearly 1 in 4 employees reported experiencing mental health problems in the last 12 months, which is much closer to data that may be expected internationally. For example, Mind Hong Kong, a collaborator of Mind UK, reported that 1 in 4 people experience a mental health problem each year. Data from other regions outside of Hong Kong should be interpreted with caution due to their small sample size. So the majority of the responses came from Hong Kong. However, in Hong Kong, we've seen that 27% of respondents reported that they have experienced mental health problems in the last 12 months. These symptoms manifest themselves in a variety of ways. Respondents reported that they have felt the following at least several days in the last 2 weeks: tired, 50%, mentally drained, 42%, sleeping issues, 41%, agitated, 36%, antisocial, 32%, and depressed, 24%. So you can see that it's actually quite a large number of respondents, quite shocking statistics. So this is similar to findings from 2008, which may indicate that this is, how people do feel generally in Hong Kong. But in 2020, stress levels in Hong Kong were also reported to be an average around 6 out of 10. So how about women and men? So women have reported experiencing higher levels of mental health problems related to mental ill health. This is not surprising in general, as women have been noted to be more likely to be diagnosed with disorders such as anxiety. Results, however, should be also interpreted with caution due to the larger sample size for women in this study. One interpretation of this data is that women may be more likely to speak up and recognize experiences of mental health problems than men, even though men are experiencing symptoms at a higher rate. So this definitely warrants further investigation. Okay. So year-on-year trends show that knowledge about mental health is growing amongst the working population. However, it is still relatively low and more needs to be done to redress this balance. And what's interesting here also is that the difference in terms of health literacy, mental health literacy, is very marginal between gender. So it's very, very small. Both men and women have been affected and impacted by COVID-19. However, it seems that female mental health may have been more adversely affected by other factors. So we can see here domestic socio-political events, international economic political tensions, and natural disasters. So the responses to natural disasters are primarily for Australia, where they had a large number of bushfires, and obviously socio-political events that relates more to Hong Kong. So one interpretation for this is the impact that it has been felt on women's life as a result of these events, such as home learning, and more on this to come in our talk. Okay? The respondents were also asked to rank their stress factors. So mental health difficulties in response to particular stresses have been acutely felt by women in some domains, and these include the fear of contracting COVID-19 itself, being able to secure supplies, and fears around losing jobs. And the latter may represent a more global phenomenon whereby, the research that I've mentioned at the start of my talk suggests that employability of women has been adversely affected by the pandemic. Men have been more affected by concerns over housing, a lack of social activities, and in particular stress over work performance. Surprisingly, for both men and women, and you can see that this is the same percentage, 21%, childcare has arisen as an equal concern and a cause of mental health problems during COVID-19. An anecdotal finding for these concerns, the impact of the ability for men to work at home due to homeschooling, and this definitely warrants further investigation. So as I've already mentioned, the fear of contracting COVID-19 and the loss of social activities are a concern for both men and women. However, of note is what happens to the data once the data are divided by those participants who have children under age 10 and those who do not. For those who have children under 10 years old, childcare emerges as the #1 stress factor, with 43% of respondents referring to childcare. This suggests that the stress is felt more acutely for those families with young children and has implications for implementation of workplace support systems and further research. And this is another interesting finding where childcare emerges as the biggest stress factor to respondents who are 35 to 44 years old. And we can assume that these are the people who have children under the age of 10. So childcare, or lack of it, is shown to be one of the main stress factors on working parents in this survey. And I would also like to note that this is one of the reasons why women were reported, or women self-reported this reason why they didn't join the workforce prior to COVID-19. However, when we conduct the survey, we generally get an idea about general trends. So survey items are specified prior to data collection, and any aspects, any details of the processes that are not easily quantifiable are missed. Therefore, we wanted to do a bit more to research this topic further, and we wanted to look at the actual interpersonal experiences of working parents, in particular working mothers, through examining their unedited online voices, and we chose as our data one parental forum or mothers forum in Hong Kong. We wanted to see how these online voices relate to the larger societal gender inequity discourses in the context of ongoing COVID-19 pandemic, and we wanted to see the evidence that reflects on the psychosocial impact of this pandemic on the mothers as they self-reported in the forum. Okay. So when we started the project, and this is the data that I'll be drawing on today, we used an English medium forum. We've since then started also, and Vincent is doing it, looking at the largest Chinese medium forum in Hong Kong, and the data are very, very interesting. So this forum is the largest forum in English, which has over 64,000 members. So I've mentioned that the forum is in English. However, it's not uncommon for posts to be followed by responses in the mother's native languages other than English. And we see quite a lot of diversity, and we can gauge this diversity by the names of the participants. And I guess it reflects the sociocultural diversity in Hong Kong, or Hong Kong populations. So the examples are member-initiated, spontaneous, written communication, and as I will show to you, some of them are quite complex. So what we've done is we've created manually a specialized corpus by first identifying the threads. Starting from the first announcement, we use the EDB timeframe as the starting point and kind of continuation of, what's the timeframe that we are looking at. The first announcement by EDB about the first case reported and closure of schools. If you remember, it happened in mid-January when the schools closed and the holidays were extended up until the end of Chinese New Year. So we identified these threads which dealt with any aspect of COVID-19 and that were posted on the forum. And then we organized the corpus chronologically. And in today's talk, I'll only draw on the examples from February 2020. And this sub-corpus for 1 month includes 139,832 words, which is quite a large corpora for such specialized, quite a large corpus because it's so specialized, okay? So we wanted to use some tools from corpus linguistics, but except for Sylvia, Jaworska, none of us are corpus linguists, so it was a corpus-driven approach. So we basically used corpus just to get some sense of what we have in the data. So we focused on salient features in the corpus, and we used it inductively in the sense that we made no prior assumptions about the data before the analysis, and we kind of looked for those linguistic constructs that emerged from the analysis of the corpus. So the most striking thing that we noted about corpus was frequency list, and I'll show it to you in a second. And basically our initial kind of corpus overview was followed by what we call theme-oriented discourse analysis. So where we read the concordance lines to get sense of the context of these interactions. And then we read extended extras and organized them thematically, and then examined selected examples more closely for prominent analytic themes that refer to the kind of language that people use when they talk about COVID and the troubles and their psychosocial needs, okay? So this is, again, I don't claim to be a corpus linguist, but I do see a lot of value in using some corpus tools. So this is a frequency list, and a lot of very well-known linguists such as Sinclair talked about how frequency lists are a good starting point for analysis. And quite striking here is that in our February corpus, the word school was the most frequent noun that occurred 1,038 times. What's also interesting that any threads that we identified that related to discussion of school closure and the impact on parents were the longest threads. They are very complex for analysis because, it's very difficult to organize them thematically, because what starts as one theme then inevitably leads, there's a lot of topic shifts and a lot of themes that these threads cover. And just to give you a sense of how long these threads can be, they're generally, comprise 20 to 25 pages of text. Okay, so that this would be one question or one post followed by all the responses. So they're quite lengthy. Okay. So before we look at the data from the posts, I wanted to say a few words about these concepts of working mothers that we use in the title in inverted commas and what we mean by working mothers. So it's a very controversial term, and we are using it to refer to a particular group of women, so who combine a career and the responsibility of raising a child or several children. And this term is problematic for several reasons, because it kind of dichotomizes the paid work and caregiving for children and suggests that those mothers who stay at home and who don't go to the office, they actually do not work. But then on the other hand, it may also be suggestive that if you are a working mother, then you're not really a mother, or you're not a mother at all times. So it also suggests that, if working mothers are at work, then proper mothers are at home, so that motherhood and parenting proper is best done at one's home, and that workspace is outside of one's home. And Interestingly also, although we hear the term working mothers quite frequently, we don't hear working fathers as frequently. And basically the collocation working father is almost like an oxymoron, because of course fathers work, right? So again, you know, we acknowledge the problematic nature of this term, and we just use it to, you know, to make it clear what kind of demographic group we are referring to. Okay. So when we compiled our corpus and we started doing what we know best, kind of discourse analysis, what was very striking is that there is a large number of mental state words and collocations, and, you know, words and collocations that imply affected mental state in the data. And these are just a few examples. My anxiety, I'm lost my sanity, I got very annoyed and angry, I'm not happy, I feel like I'm going crazy, it's driving me crazy, one crazy mom, I'm having a nervous breakdown, it's stressful, it's taking its toll, I'm struggling, no help and no sleep and lots of wine, and I'll come back to wine. So you do see a lot of desperation in this post. And basically, what we wanted to do, so we know, and the survey has very clearly shown that childcare is an issue, but it doesn't really give you all the nuances and all the details. What exactly do parents struggle with? Why is it a mental health stressor? So the idea that we had is that if you delve into these discussion forums, you can actually get a more nuanced picture. So the focal themes that we identified, which relate to childcare, and surprisingly, the first one is actually a positive one. So posts and discussions that viewed COVID-19 as a gift to parents and children to teach and learn things that cannot be learned at school. I must say that it wasn't, it was prominent enough, but it wasn't the main theme, okay? So most of the themes are more negative. So homeschooling is a full-time job and it is very stressful. So it's a job that comes on top of your regular job. There is a lot of concerns and worries about kids missing out on their education. Parents are not teachers, and interestingly enough, even those parents who are qualified teachers and who work at schools struggle to teach their kids, you know, even if they are teachers in real life, they can't be teaching their own kids. The next thing that we identified is unsustainability of the work from home and homeschooling situation. Lots of talk about, lots of discussions about financial concerns, school fees, bus fees, other providers' fees, parents seeking to get reimbursement of those fees, lost jobs, inability to pay the fees and to keep their places in school. And then a theme of coping and support mechanisms. So women are experiencing all these problems and how do they cope with them? So community support, a very Hong Kong, I suppose, sub-theme of domestic helpers and tutors, discussion of online resources and humor, and a lot of wine. So I've promised to come back to wine and I'll talk about wine a bit more later. Okay, so I'll give you some examples, and I will start with this positive, positive viewing of COVID as a gift. So this is the original article, so the initial post by an author who posted a link to the article by an educator and writer, John Holt. So John Holt was a big proponent of homeschooling, and according to Holt, home is a fundamental human institution where learning happens more naturally and organically. So the author concludes her post with an encouragement to the mothers to teach their children things that cannot be learned in school. While the post is an example of information giving or information sharing, it can also be read as an example of indirect advice. And as it transpires in the discussion that follows, the author of this post is a teacher who is well known and respected by some of the moms. So when someone gives us advice, a natural response to advice giving, or a preferred response, as conversation analysts would call it, is either advice acceptance or advice rejection. So the online interactions that we are looking at are examples of informal interactions where participants are not really subject to many constraints, for example, like in institutional interactions, or they're not really accountable to other parties. So they're free to do, in a sense, whatever. They can reject the advice, they can accept the advice, they can shift the topic and talk about something else. So, and we see it quite a lot. So if we look at research on advice giving online and also on advice giving, there's quite a lot of research on advice giving conversation analysis. They talk about rejecting or resisting advice, content, or the action of receiving advice. So when advice is unsolicited, you may not want it. You may reject it because you just don't want anybody to advise you. So what we can see in the responses here, they're very typical, okay? So yes, it's a gift and I should enjoy it given that parents don't have to work. It's a bit difficult for moms who have to work to rely on school to teach the kids so they can work. A bit harder to homeschool when moms and dads are working. For me, working from home is a nightmare. Homeschooling is great if moms don't have to work full time. So what we can see here, it's not so much the action of receiving advice that is being rejected and not even the content. They don't say, no, it's, I shouldn't be enjoying my time with the kids. But it's a more complex issue of putting these mothers into this morally compromising position. If it's a gift, and if you're a good mother, then you should be grateful and you should enjoy it, right? And you would naturally feel like you have to defend your position if you're struggling and you're not really enjoying it, okay? So there's quite complex identity work and quite complex negotiation that is going on here, okay? I'll show you snippets of examples. I think the main idea is that we have this overarching theme of childcare, and then developing into qualitative data allows us to see which aspects of childcare, and of course you can, elaborate on your analysis. So theme 2, as I've already mentioned, is homeschooling is a full-time job, and again we can see reference to these mothers' mental health, that it's stressful. And this mother narrates, her story of having 2 kids at home and she has to work from home. And she concludes by saying, I feel every day time flies and I always feel I could have done more with her. And then 6th advice, is this normal? Okay, so it's trouble telling that goes into advice seeking and it is self-initiated. What's interesting in these replies, the mothers are not judging. They're not saying whether it's normal or abnormal. So the responses demonstrate alignment, understanding, and support and empathy. And it goes in line with all the research on online forums that, people like previous research says that these are basically platforms where people seek support and empathy, okay? So the mothers are in this situation together. They are experiencing the same issues. They're not afraid to acknowledge openly. And this is quite an interesting platform where you can talk openly about issues and problems which would be frowned upon in normal life. There is a lot of research on online forums talking about, issues which are stigmatized in society, something bad happened or issues which are difficult to talk about. But here, basically, mothers are talking about, having trouble and, having difficulties being full-time employees and also being full-time mothers, okay? So the mothers are not afraid to acknowledge openly that they're struggling to keep up with work and childcare. And the forum thus provides these mothers with an opportunity to narrate their troubles and to share online. And by doing so, they make sense of their troubles and renegotiate their identities as mothers who have the right to struggle and who are struggling to keep up with all the demands posed on them by the pandemic and struggles as the cause of having to juggle full-time childcare and work, okay? So the next thing that is quite prominent in the data is worries about kids missing out on their education. And again, the mother, frames it as a concern, as a worry. So my kid is not learning as much as he does at school. I'm worried that he won't be able to meet the learning goals of this year and be capable to catch up in next school year after summer. Okay. I won't elaborate on that example because it's quite short. Okay. So parents are not teachers, okay? So there is a lot of talk about teachers, and Vincent a week ago gave a talk at the Education University of Hong Kong about parents being thrust into this position of having to teach their kids and complaining about not knowing the methods of teaching and facing all sorts of struggles. So he's now working on the paper that hopefully will be finished and submitted quite soon. So the discussion of parents not being teachers is prompted by a post from Janice, who talks about this homeschooling and teaching the kids requires a lot of supervision. And again, here we see some humor, and when we have humor, there are always emoticons, mothers talking about turning into some type of weird monster, homeschooling my kids and juggling work from home, complaining about having the worst patient with their children. I can't do this long term. I feel bad for shouting at my children's side. And as I said already, what's very interesting in this theme is that there are quite a few responses from teachers who admit to experiencing this trouble teaching their own kids. And this mother says that I can get 30 kids in a classroom to do pretty much anything, but can I get my one son to do even one thing at home? No, not at all. Parenting is hard. Okay. And the last example from our qualitative corpus in Hong Kong that I want to show to you is how do mothers cope? So these online platforms are platforms where mothers can share and they can see so they are a community of practice where mothers can seek the support of other members of that community when they struggle with the situation. So this post wasn't a rant about having to do schooling or homeschooling or having to work at the same time, but it's a post from a mother who felt creative one day and decided to write a song based on a musical that I remember being my age, Grease, that starred John Travolta and Olivia Newton-John. So basically rewriting the words of the lyrics of the song to talk about the pandemic and how the pandemic is terrifying and how she's losing her soul because the virus is multiplying and it's stupidifying and so on and so forth. Okay, so if you know the song, for some reason I can't play it off my computer, then you can follow the lyrics. What's interesting here is the responses, and besides doing all the things like giving support to each other and empathy and discussing things and providing information. So what these mothers also do, as unlikely it seems to be in this situation, is they have fun together, right? So they talk about struggles, but they also laugh about those struggles, okay? So we can see it from the responses, lol, I can relate, lots of emoticons, laughing face, crying face. My son is tired from all that couch potatoing. My BFF is a working mom. I'm truly housebound on my computer, literally 14 hours, okay? So in our larger project, so I've shown you some examples from Hong Kong. I didn't elaborate on them, but you get an idea of various angles of the struggles that the mothers face. I want to show to you also a couple of examples from other parts of the world. So in addition to our Hong Kong data, we've also collected some data in Chile. So this was done by research team member Mariana Lazzaro-Salazar. So who looked at online community of moms. Her community doesn't have male participants, and in Hong Kong, in the forum in Hong Kong, we do have male participants. And she collected her data between March and October 2020, so a very similar time frame, but the onset of the pandemic in Chile happened slightly later than in Hong Kong. So the website displays the information about COVID to members in very explicit and clear ways. It's the forum that she looked at has been running for 4 years, and it's a slightly smaller community of 5,000 members with an average of 90 posts a month, but her corpus is quite large, 17,000 words of posts on COVID-19 analyzed. The differences that we see, so we see a lot of similarities, struggles, and women are finding it difficult to cope. But I would say that the general kind of mode of these online discussions in Chile is much more positive. So one theme which is very prominent is this COVID is a gift, okay, as this one example illustrates. So the quarantine has been a beautiful invitation, an opportunity to love ourselves in order to have the power to love and to heal the family. In this process, the message that I send to everyone is that we must see opportunities to transform and paint this new life with colors. So you get the gist of the idea. What was very interesting about Chile, so we were discussing this kind of multiple references to wine as one of the coping mechanisms, and kind of jokes around, teaching your children how to make a nice cocktail. Messages like that are completely absent from the forum in Chile. And, according to my collaborator, it's really frowned upon. It's not a coping strategy for mothers, and people don't joke about it. But, trying to look at the pandemic in positive lights is evident in these corpus. But as I said, the overall kind of sentiment is women are struggling mentally to cope. Being positive doesn't mean not having low moments, feeling tired and overwhelmed, as this both suggest. So I've talked so far about mothers, but as we've seen from the survey, mothers and fathers, and particularly with regards to childcare, report to be affected by COVID and lack of childcare to the same extent. This is a mothers forum, but it does include some fathers as members. And we do see references to fathers taking on a lot of work at home. So my kids hate me and they're dead for helping them with home learning. So there is overt references to fathers' involvement with homeschooling. So in another post, I found dads often get left out of these conversations as if kids have one parent capable of supporting learning at home. So implied fathers' involvement with children, okay? So we see some fathers actually getting quite active in the discussions. For example, this participant, Duncan, says, good school is an interesting concept that is foreign to most local schools which our children attend. And we can also see that both mothers and fathers are using plural references. When they talk about childcare, we have them get up at approximately the same time as if they have to go to school. Sometimes we may try going forward is having them put on their uniforms on. So we can see that fathers are actually ratified participants of this child caring process and schooling, homeschooling. And despite the fact that it's a forum for mothers, their voices are heard and their voices are brought in. Okay, so I now want to spend a few minutes kind of discussing and posing some questions. What does our data tends at? So we can see from the literature that these discourses of gender inequity tend to be exclusionary and focus on women. So, this very concept of she session and, the discussion of how women are affected. So these discussions perpetuate gendered assumptions about roles and responsibilities at work and at home. So what is known in linguistic research as hegemonic femininities and hegemonic masculinities. So women are affected and less focus is placed on men. I think that research on gender and COVID-19 across disciplines needs to follow suit of language and gender studies and focus on all parents of all genders and other aspects of identity. It's not just mothers who are being affected, it's also fathers. And, we don't have mother-father kind of, families take on different forms and shapes, right? Being at work and being at home is also traditionally dichotomized, and parents are put in the position of having to make a choice. And I think, COVID has really exacerbated this situation. So someone has once told me that working mothers, and, I'm a working mother myself, are expected to mother like they don't work, or to parent like they don't work, and to work like they do not parent. And this is a very difficult undertaking, and something needs to be done, and somehow it needs to be acknowledged. So a crisis, as both our quantitative and the current crisis, as our quantitative and qualitative data has demonstrated, has exacerbated existing issues, but it also brought in new challenges. So the pandemic has forced us in the position to reconsider mainstream ideologies and social constructions of gender, parenthood, family, paid work, unpaid work, but also workplaces and workspaces. So these are all it's almost like anything that has been done prior to COVID that related to workplace research needs to be reconsidered. So these new work orders, but also with regards to family and arrangements, work-life balance, everything needs to be kind of examined through new lenses. So what we've seen with our qualitative data, these online forums provide a space for its participants to negotiate these mainstream hegemonic ideologies and social constructions. And it's a dual process. On the one hand, they are shaped by them, but by discussing and engaging in these discussions, they also contribute to shaping them. The fora are very important platforms where these contributors, the participants, can share information, solicit advice, and provide support, etc. But also importantly, have a laugh together. So in the context of all the restrictions and lockdowns, these can be the closest people you have to discuss all the troubles that you have. And for researchers, such qualitative data provide a very invaluable input. We can gauge people's real life experiences. So when we want to see kind of nuanced picture or construct a more nuanced picture, we need to use appropriate methodologies, both for data collection, but also for our data analysis. So we've seen the impact on mental health of parents who work, both mothers and fathers, in both our qualitative data, but also in our online data. I think that the overlap in the data, in the findings, is quite striking. So childcare is a mental health stressor, but if we supplement surveys with qualitative data and more in-depth investigation, we can really get this nuanced picture. But most importantly, this nuanced picture includes the voices of real people. COVID has been, it's been a long journey. We've seen a lot of up and downs, and we are currently going through the fourth wave. Nobody knows how it's going to develop. But what's very clear, the impact of COVID on mental health is likely to be seen for many years post the pandemic. Therefore, we see all these references to mental health, and we see all this evidence about the impact on mental health. It really needs to be prioritized. So support measures by companies and support measures that the government develops need to include the voices of real people and go several steps further than providing flexible work arrangements or producing self-help information leaflets. And these arrangements can go as far as adjusting expectations, right? So what is expected, I can assure, I haven't seen these emails from our employers, and I'm not sure how many of you have seen explicit emails about what the expectations are during these times. We're all under a lot of pressure trying to do what we did prior to the pandemic, but is it really realistic? Is it really possible? So employers and governments need to look into active caregiver strategies, reduced hours, financial support that actually reaches the employers, but not the employees, but not the employers. So obviously all these measures could be taking a bit further, and we can learn from the project that we're still working on. Thank you. Yeah.
Thank you, Olga, very much for a really interesting presentation. I just would like to now open the floor to questions, but I want to just specify how we'd like to do this. if you have a question, you can type it in the chat function, or if you would like to ask a question verbally, please also indicate that to me in the chat function, and we can, unmute your microphone. So please, if you have questions, go to the chat function and let us know what your questions are. While we're waiting for that, I'll start off, I guess, and I'll take the chairperson's initiative. And my question, Olga, is that I'm curious about this issue of mothers and fathers, and you're saying that, well, fathers are also working from home and etc. In your corpus, did you see any evidence of people actually head-on talking about this topic, or saying anything about the division of labor at home despite the pandemic? Where, was there anybody commenting on unequal division of labor with child care in this situation?
Yeah, thank you for your question. I think this is like one of the points that we are making. So there wasn't any kind of explicit posts about, I'm working more than my husband, and we as women are much more affected than men. It was quite the opposite, where, whenever members said something about fathers being affected as well, then, there was this unanimous agreement, thank you for saying something about the fathers. Fathers are also affected. So it's almost like, it's not about the division of labor and women being affected more than men, but it's about, parents struggling, and families trying to balance this work-life, responsibilities and doing it together. But the forum is designated to mothers. So it's actually quite, quite surprising to see fathers being so actively involved, like posting questions and, responding. They do, but they're definitely not the majority. And therefore, I think most of the, we haven't done the qualitative comparison, but most of the messages through kind of intensive reading of the data come from mothers.
Okay, thank you. Rodney Jones would like to ask a question, and he's been unmuted. So go ahead, Rodney.
Yes, hi, Olga. Thanks very much for the talk. Really, really interesting. I think you have some really rich data, and the way you're approaching it is just fabulous. I love the themes that you are picking out. My question really follows on from Brian's question, having to do with the kinds of understanding the kinds of parents that are included in your data, but also the kinds of parents that might be excluded from your data. And of course, fathers are as you say, often these forums, they even have the name mom in them, and they're very much kind of gendered themselves. But my question really has to do with this kind of data in general. Internet data from these kinds of internet forums, and especially around COVID-19, where a lot of data collection now is online. I wonder if you could talk a little bit about the kinds of parents, not just in terms of gender, but also in terms of class, the kinds of parents that might be invisible in this kind of research, and the kinds of mental health problems that they might be, that may be from the kinds of parents that you see in your data.
Yeah, so I thought, thank you so much, Rodney, first of all, for joining all the way from the UK, but second also, for asking me the questions that make me think about the data more. So I would say that the majority of the participants in our data, and there are some explicit discussions about, working mothers versus non-working mothers, and kind of sometimes there's this polemic about, you think that if we stay at home that we don't struggle. I would say that the majority of them are middle class. Some of them are in employment, some of them are not, but they wouldn't be kind of from any sort of deprived socioeconomic backgrounds. And that, of course, reflects on the data. So if these women are working, then, the main topic that we want to look at, the impact on this work-life balance, in that sense, it does fit. So the forum is in English and it's got 64,000 members, which is quite large. But we are very aware that English speakers are not the majority in Hong Kong. And therefore, we're also looking at the forum called Baby, Vincent is leading that research, a forum called Baby Boomers, which is an open access. So for this particular forum, it's members only. So we had to kind of think very careful about all the ethics issues and online access to data. So the Chinese data are quite strikingly different, even in terms of, today we were discussing coping strategies and, how in the English data, even the kind of songs that people use to change the lyrics, and the kind of jokes and the kind of humor that they use, it's very, very different. So it's by no means it's representative of all working parents in Hong Kong. That I'm very clear about, but I would say that this is one of the most, we did try to join online forum called Fathers in Hong Kong, but never got any response, and it only has 5,000 members. So we did try to kind of incorporate others, others as well.
Okay, can I just follow up?
Mm-hmm.
Yeah, sorry. Can I just follow up? Can you talk a little bit about what we might do to capture the experiences of parents who may not be on online forums, whose kids may not even have access to computers, whose biggest problem with their kids not going to school may not be that they can't learn, but that they can't eat because they don't have access to school dinners. But how do we get to those?
I think this is a big issue it's definitely an issue that has been reported in the UK, right? And this is why I think one of the reasons that prompted the government to keep the schools open, right? That, reports started emerging that children who stayed at home were actually were put into a more vulnerable position in comparison to if they went to school and, they faced any risks of contracting COVID. For us as linguistic researchers, I think to reach those people who are not online, we need to go offline ourselves, right? And I've mentioned these groups of people who are, I haven't seen any reports for Hong Kong. I don't know if Zoe, she was in the audience, but she's also, a very active member of the research team, if she's seen any reports like that. But I've mentioned the demographic groups which are more affected, which are affected more by COVID, right? And that includes single income parents. It includes ethnic minorities, all these other groups. And I suppose, it's the old school interview and ethnographic observations going into the community, which may be very difficult during COVID, right? So people do not necessarily want to meet face to face. But it is important to incorporate the voices of those people as well. And I think in Hong Kong, with schools being closed for such a prolonged time, and whatever way these decisions are made, there may as well be implications for those communities, as we've seen in the UK, right? I don't know if you would have any other suggestions, Rodney. I'm always open to what you have to say because you always have very nice insights.
Yeah, no, I agree with you. This is a huge challenge because I think that relying on online data creates a huge lacuna that those people who don't have access to those kinds of resources, and the only way to do it is just to go out to them. But when you're in a global pandemic, that does become awfully difficult. And so I think we just have to be imaginative. I know that a lot of interesting work has been being done in African countries around mobile phones. People may not have computers, they may not even have access to sort of broadband internet, but they have a cell phone connection, and setting up certain kinds of low cost mobile apps to try to gather data from this kind of community, and working with the community to do that has shown, I think, some degree of success.
Yeah, I think Zoe wants to add something. Yeah.
Hi, thank you for the questions. Yeah, just very briefly, I know that mobile phones have been used in other countries, and I think that might be one way of accessing people. There is also a very active network of charities and other groups working in Hong Kong, and there's sort of WhatsApp groups of charity leaders and things like that that might be, and they are providing a lot of support to other communities in Hong Kong, particularly, you know, even things like printing out worksheet materials for those children who are at school, giving meals, things like that. And so I wonder whether there's maybe something that we could do around accessing those leaders of those charities to try and access a different way of reaching people. That might be one option we could explore.
Yeah, thank you, Zari.
Great. Yeah, thank you, Olga.
Thank you so much, Rodney. Thank you.
All right, there's another question in the chat room from Eric Lin. And so I'll have you seen it, Olga, or you want me to convey it to you?
Yeah, the name of the forum, right?
Yeah.
You're referring to this one. I suppose the name is not, I mean, we have to anonymize it and all the publications and things like that, but it's the largest forum for moms, which is called Hong Kong Moms. And it's Rodney said, you know, a lot of these forums have the word mums in them, or fathers for that matter. So the UK forum, so one of our team members is Sylvia Jaworska from Reading University. We didn't include any data from the UK, but there's also a similar large forum in the UK like that. Yeah.
All right, does anybody else have any questions? Please, we do have some more time. All right, well, if there are no more questions, then I'd like you all to please join me in thanking Dr. Zayts for this really interesting and insightful talk. And thank you very much.
Thank you. Yeah.
Oops, we had another question come through. Perhaps, would you like to answer it quickly?
Okay, so the question refers to domestic workers, right? Okay, so when I talked about, so I didn't give any examples, but domestic helpers are actually quite a prominent sub-theme in, you know, kind of the theme that we call coping strategies. And the examples are very interesting. So mothers are talking, so because obviously you have to outsource help. And a lot of the members, you know, expatriate members do not have family support in Hong Kong. And of course, you know, they have to rely on domestic helpers. But it's what's interesting, like one of the things that we were discussing is that there is this kind of renegotiations of roles and responsibilities and identities that's going on, because parents are not teachers, but so are not domestic workers. And they're thrust into the position of having to supervise online classes and basically do all the work that, if not teachers, that support teachers do at schools. And what's quite interesting is that mothers talk about asking their parents, their helpers to do it, but helpers not being happy to be put into that position of having to do more. So I suppose from the viewpoint of parents, this is positive, having, you know, another pair of hands and another person at home to help them. But then it's a different kind of issue if we look at it from the viewpoint of helpers. So the way they, you know, the issue of having domestic, you know, helpers at home, the way it comes up in the forums as one more support mechanism, you know, like one more resource that these working parents can rely on.
Okay, great.
Thank you.
Well, thank you for dealing with that question, Olga. One thing that Olga asked me to mention was that there's a new PhD position that's being advertised right now in cooperation with Mind Hong Kong. It will be on mental health and destigmatization, and the details are on the School of English website. We'd also like to put up a slide that links to our websites, and Christine's going to do that. All right, so there it is. And Olga, if anybody has any other questions, is it all right if they email you at your work email?
Yeah. I would appreciate the comments and the questions. As I mentioned, the project, we have a lot of data at the moment, and just February data is over 139,000 words, and we're already in December, and we are starting to think about papers and reporting the findings. So any suggestions or thoughts or ideas would be very, very helpful. And I'd like to thank you in advance on my behalf and behalf of the research team for these questions.
Great.
Yeah, thank you.
All right, with that, we'll bring it to a close. So
Yeah.
thank you for coming again for your talk.
Thank you.